Nursing 1000 final project. Getting to know Melon. So Melon's a 17-year-old in her first year of her undergraduate nursing degree. She decided to move away from her supportive roots and attend a university that was 4 hours away from home. She currently resides on the residence there. Melon has been having trouble attending her morning classes due to partying and staying up late. She has also been experiencing deteriorated eating habits, causing her to gain 15 kilograms in the past 6 months. Melon has also been unable to attend church due to increased school workload.
So for the assessment data, when addressing Melon's story, we decided to focus heavily on her physical health. So when assessing how best to address this, we decided it would be best to obtain information referring to her level and type of physical activity, her height, weight, eating habits, sleep habits, etc. So for example, inquiring about her sexual history and pregnancy testing can help us determine whether her weight gain was due to eating patterns or something else, which would shift how we address her healthcare plan. Knowing personal and family health history, such as diabetes or other diseases, can let us know if she has any restrictions to eating or working out. After collecting these important parts of Melon's health history, we will be able to better decide how to help her best, hopefully within her own means, to effectively work on bettering her physical health.
All right, next is priority health issue. So focusing on the topic physical health, we have noticed Melon's weight gain of 15 pounds since starting her university life. She has increased her unhealthy food consumption and her behavioral health has changed. This shows us that she's at risk for being overweight. The formal nursing diagnosis we would be focusing on is Melon's physical health relating to her weight gain and negative habits in her everyday life. This could be related to eating in response to internal cues and other hungers such as stress, anxiety, and disorders. Melon is also a university student, so her daily factors affect her overall health.
So next I'll be talking about the goals and the objectives that we set up for Melon. So we came up with 2 goals to help Melon achieve physical wellness. So the first goal, by the end of the semester, Melon will adhere to 150 minutes of physical activity. This can be achieved by being physically active at least 3 times a week. An example could be walking for 20 minutes and increasing the time by 10 minutes each week. This can also be completed through various other activities such as swimming, biking, and or using the gym at the school if available. Results can be measured by tracking weight goals at the first of every month to achieve her overall weight goal. So basically, this goal is just striving for Melon to be more physically active. It is specific as it's relating to her own exercise routine. It is measurable by tracking her progress on her phone. It is achievable as she only needs to exercise 3 times a week starting at a reduced amount. It is relevant as exercise will help reduce the risk of becoming overweight. And it is timely that it is only 3 times a week exercise routine that increases the time spent per week. We hope that by the end of this goal, or by the end of the semester, that she will be able to achieve the 150 minutes. The other goal, goal 2, is by the end of the semester, Melon's diet will have grown to include fruits and vegetables in her daily intake and following the food guide limits. Her diet will also follow the daily intake by limiting her alcohol intake on nights out. This can be measured by keeping a daily intake journal to track her dietary goals. In other words, this goal is striving for Melon to eat more fruits and vegetables. It is specific as it's relating to her own diet. It is measurable as she can track her progress on her phone or on journals. It is achievable as we are slowly increasing the number of fruits and vegetables consumed until it reaches the Canadian Food Guide minimum. It is relevant as a healthier diet will help reduce the risk of becoming overweight. And it is timely as per week she will increase her intake of fruits and vegetables and hopefully will meet the Canadian Food Guide minimum by the end of the semester. And overall, we hope that these 2 goals will become a habit over time.
For our implementation plan, we've come up with 3 interventions to help Melon achieve her goals. The first practice will be providing methods of contact. She'll be provided with the nurse's contact information in order to bring up any concerns or update them, and she will also be provided with a list of free community and campus resources. By providing her with these methods of contact, it can help her feel supported as she pursues her goals, and some resources also might directly help her reach them, such as ones revolving around healthy eating and exercise, which leads to our second practice. In order for Melon to achieve her SMART goal of 150 minutes of physical activity a week, she must take part in different workout routines. Before implementing them, the nurse can ask what workout she would be most comfortable with and recommend a routine based around them.
The nurse can perform these workouts for her beforehand so she'll get an idea of the form and tempo they should be performed at. Our final intervention will be tracking progress. Monitoring goals is crucial to meeting them. The nurse can set up weekly meetings and goals for Melon so she can gradually increase her activity instead of immediately rushing into vigorous workouts.
So our evaluation plan. This is a rough evaluation plan that we created for Melon in order for her to track the progress. Melon will begin with smaller objectives, such as 20 minutes of exercise 3 times a week and eating half a cup of fruits and vegetables daily. Melon can also sit down and track whether the goal was met and what she can do to implement different things in order to meet the goals.